brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just joining us, we are talking to Express Care's Dr. Jitka Lom, and she's taking questions on everything today. So let's get to some of our viewer questions. Jimmy from Mighty asks, what foods make cholesterol levels go up and what foods make it go down?
Very good. Cholesterol is a fat that's actually produced by our liver. Even if you eat absolutely no cholesterol in your diet, which is impossible, but if you did that, your liver would still produce it. So the foods that aggravate that are the ones that are greasy animal products. So we're talking fried foods, greasy meat especially. Other foods that might increase it are the foods that include a lot of added sugars and dairy products such as, for example, mashed potatoes with a bunch of fat and cream and all that good stuff. Yeah. And another source people don't think about is popcorn with all of its, greasy butter and so on top of it. So staying away from greasy fried foods and animal products is your best bet.
Okay, now what foods would make it go down?
Okay, so fruits and vegetables are very important. Plant-based diet, and oatmeal is very helpful. Salmon and tuna, very helpful, as well as nuts, almonds, and walnuts.
And Cheerios, I think, right?
That's right.
All right, if a product packaging says low cholesterol, does it also mean that it's low in fat? And that comes from Janet in Sinahanya.
No, that's a great question, Janet. So what would be a food that would be low in cholesterol and high in fat? We can think about coconuts. Coconut milk, very high in fat, but low in cholesterol because it's not an animal product. Avocado would be the same. So no, if you're looking for low fat and low cholesterol, then you're going to be looking at mostly fruits and vegetables.
Okay. Pete from Inarahan writes, are apple cider supplements effective in lowering blood sugar?
Very little, Pete. They are helpful in reducing your blood sugar because they contain a little chromium, which you can get in other sources. Vinegar tends to make people feel full, so it might help with your weight loss project. It's not harmful to you, but it's not going to solve the whole problem.
Okay, Therese from Agania Heights writes, what is the DASH diet?
Okay, that's a diet it's a dietary intervention to stop hypertension, meaning high blood pressure, and it's a low sodium diet. It's less than 2,300 milligrams of sodium per day, and it's also it includes a lot of grains, fruits and vegetables, and very little meat and grease. So it's a good diet to follow if you have high blood pressure. Also, it tends to promote more potassium in your diet, which is helpful for your blood pressure.
Okay, someone from Manila writes, what are some natural remedies to treat an overactive bladder in adults?
Right, and that's a common problem. Overactive bladder, you can do two things to help train your bladder. One would be to schedule voiding, cell phone, go to the bathroom every hour, just void and get it out. And another way would be to do something called Kegel exercises, which you can look up on the internet, but they're basically pelvic floor exercises where you're squeezing your butt cheeks together when you're sitting. That's a simple one. Or when you're voiding, you interrupt your voiding, stop, start, stop, start. And that helps train your bladder to listen and obey better. And then there are some herbal supplements that you could try at the vitamin store, including ginseng, ginger root, these type of things, but they're usually less helpful.
Okay, Randy from Dedido writes, how does joint damage occur from rheumatoid arthritis, and can it be prevented?
We talked a little bit about psoriatic arthritis, and rheumatoid arthritis is another very disabling condition, extremely painful. So how does it happen? Well, your immune system gets a little confused and thinks that there's an infection inside your joints where there's no infection. So it sends all these destructive toxic chemicals into the joint space. There's nothing to fight, so they're just causing damage. And the chemicals destroy the cartilage, chew it up, and they also make the lining of the joint proliferate, meaning spread to where it shouldn't be. So people end up with a very swollen and boggy joint. Can affect hands, feet, neck, shoulders, anywhere. But again, a very disabling condition. So how to prevent it, treat it early. That's one thing that you don't want to progress. So although people say, oh, I don't want to take medication unless I really have to, this is one situation where you don't want to wait till it's too late and you're already crippled.
Well, speaking of arthritis, I want to throw in one other question before we get to our last one is, what can people do about arthritis?
Regular arthritis that comes from wear and tear is something that comes sort of in our 40s and up, and tends to affect our hands, feet, if we've had old sports injuries and so on. And if you can prevent it by not having repetitive trauma to your joints, that's most helpful. But then the morning stiffness that people might have, or the pain that they have, they can treat that with heat. They can use Tylenol, and most of all, stay active and exercise to keep those joints supple.
Okay, and our last question comes from Maria from Dedido, and this one, Doc, is way off what we've been talking about, but can tight braids on my daughter cause hair loss?
A great question. Yeah, that's called traction alopecia. So the little girls that have their hair pulled back really tight, yes, it's actually harmful, and you rip out the follicles and it's permanent. So you actually keep pushing the hairline further back by pulling the hair back so tightly, and some little girls have really thick, heavy hair, so best to keep it a little shorter rather than the really long braids, so that you don't pull on the scalp.
So not too tight.
Not too tight, and a little shorter.
All right, Doc, thank you. You've been such a good sport going through all of these questions. We appreciate it. Thank you again, Dr. Lom, and the doc will be back again next week as we near the end of 2011. We'll be talking about quitting smoking, and that's, I think, a lot of people's New Year's resolutions. So make sure to send in your questions, and you can send those to healthyliving@kuam.com, or you can post it on our Facebook page.